Here are 5 critical steps that you can take if you're a medical provider, mental health provider, aging services provider to improve quality of sleep and brain health. The first is to assess for insomnia. Simply ask questions like, do you have trouble falling or staying asleep? Are you worried about your sleep? Is your sleep frustrating you? How many hours of sleep are you getting? Tell me about your sleep. How do you feel during the day? Full of energy or really tired and lethargic? You can use tools like the Insomnia Severity Index to track symptoms and the impact of sleep. You can also change the narrative, validate sleep concerns. So instead of saying, oh, that's just what happens as we age, instead say, yes, the sleep architecture and the quality of our sleep does change with age. But it doesn't mean that's something you're just going to have to bear. It isn't something that you just have to live with. Maybe we can improve it a little bit or a lot. Cognitive behavioral therapy for insomnia is the gold standard treatment for insomnia for all age groups, including for older adults. And the great thing here is that it doesn't include medication. It's actually recommended before medication for older adults. And this is because often the medication used for insomnia among older adults is contraindicated or is on the Beers list. The Beers list is a list of medications and over-the-counter supplements and medications that are contraindicated for older adults, and in some cases can increase what looks like cognitive impairment among older adults. So on that list are things like Tylenol PM and Benadryl. And those are often what people are using to help with sleep, but they're not good for older adults. And so cognitive behavioral therapy for insomnia is the recommended treatment. You don't have to be a mental health provider to recommend some of the strategies that are common with cognitive behavioral therapy for insomnia. And I'm going to share some of those with you now. So one is sleep restriction. To spend the time in bed only when you're sleeping. To avoid naps throughout the day. So the sleep restriction being like to reserve your sleep time only for nighttime. So no naps during the day, and to really just have your sleep time be your nighttime sleep. Another is called stimulus control. And that means that you only use the bed for sleeping and intimacy, nothing else. No screens, no stress like talking on the phone and having an argument. The bed needs to be associated with sleep and intimacy only. No screens, no stress, no snacking. Another is cognitive restructuring or reframing. An example here would be to change catastrophic beliefs like I'm never going to sleep again to something more accurate. I'm awake now, but I can get back to sleep later. Another is relaxation training like progressive muscle relaxation or mindfulness or meditation before bed. And other things like keeping a dark room, a cool room, free of distractions, free of noise. And another that people don't often talk enough about is having the same wake time every day. Those are just some quick principles from cognitive behavioral therapy for insomnia. This is just a couple of seconds of recommendations. This is not the full list of recommendations, but just gives you some ideas to get started. Another thing you can do is assess for root causes for insomnia. So sometimes insomnia is a signal that something else is happening, like unresolved trauma or grief or caregiving stress or not enough support with caregiving, unmanaged pain, untreated medical illness that's not properly treated, over medication, being prescribed too many medications, or not understanding the pacing of medications. And so, spending time understanding the root cause of the insomnia may help to guide you in how you might coach or provide support to the client. And so, if it's poorly managed pain or medical condition that's poorly managed or difficulty pacing medications and the medical provider or the prescriber doesn't know that the person is having these symptoms, you may be in a really important position to guide that person in having conversations with their medical providers or prescribers. And so just getting clear about what the real concerns are. And as it relates to caregiving concerns, making sure that the caregiver has scaffolding and support so that they could get a good night's sleep as well as they care for somebody. And especially if they're caring for somebody with dementia, people with dementia often have sleep problems and have difficulty with their sleep wake cycles getting reversed. And this can be a challenge for many dementia caregivers. And so making sure that dementia caregivers have support is key. And really, caregivers of all conditions deserve support. And the fifth thing that you can do is to collaborate with medical providers. And this is really important because obstructive sleep apnea also increases the risk for dementia disorders. And you, as a mental health provider or aging services provider, you don't want to be the only person on this individual's team providing care. That person needs to see their primary care provider and may likely need to see a sleep medicine provider as well, and to get a sleep study done to understand their sleep architecture and what supports they need in place for their particular concern. And so you want to be working with and referring to primary care and also sometimes to sleep medicine to understand what's really causing the sleep disturbance. Primary care to help optimize, like what we were just talking about, medication pacing, medical problems, chronic pain, etc. And then sleep medicine providers to potentially do a sleep study or understand if there's restless leg syndrome or sleep apnea. And like I said, you don't want to be the only person on this client's team. You want your client to have all of the providers providing input and support to optimize that person's health and functioning. And as we were talking about earlier, there are many medications and over-the-counter medications that are contraindicated for use among older adults, like Benadryl and Tylenol PM or other sedatives, that older adults, if they knew what the consequences were, may choose not to use them. And so working with primary care providers to help provide that education and assess for some concerns related to that is really important as well. So, as with other conditions, the earlier we can identify sleep disturbance or insomnia, the better. And as I mentioned, cognitive behavioral therapy for insomnia is the gold standard treatment, and it tends to be time limited treatment as well. In my comprehensive mental health and aging certificate program, which is an 18-hour program that I offer a couple of times a year to train mental health providers in providing psychotherapy to older adults, we dive deeper into cognitive behavioral therapy for insomnia. So I hope that you check out my certificate course when enrollment opens. Here's what's important to remember. Sleep problems are not a foregone conclusion among older adults. Older adults benefit from care, benefit from collaboration with their medical providers, benefit from sleep studies to understand how to optimize sleep. And you have a really important role in helping them to gain those resources and a better quality of life and better brain health down the road. So thank you for being here and doing your part, because you really do have an important role in making sure that older adults get the mental health care that they need and deserve. I'm Dr. Regina Koepp. I'm a board certified clinical psychologist and geropsychologist, and I founded the Center for Mental Health and Aging. If you enjoyed this episode, please subscribe and leave a review and share with people that you think might find this helpful. It really does help other people to find this information and improve mental health for older adults. So thank you for being here and doing your part.